Scoliosis Myths and Misconceptions. Why posture, backpacks, and high heels aren't the villains. Scoliosis is one of the most misunderstood health conditions today. If you've ever been told that your posture caused your curve, that only girls get scoliosis, or that surgery is the only answer, you're not alone. These are just a few of the many myths that continue to spread confusion, fear, and frustration among patients and families. This book was written to set the record straight, in plain language that makes sense for everyone, including teens and parents just beginning their scoliosis journey. For too long, scoliosis has been viewed as a simple problem with a one-size-fits-all solution. But in reality, scoliosis is complex. It's not just about a curved spine, it's about the way the brain, muscles, and bones interact. It's influenced by genetics, growth patterns, hormone changes, and even emotional stress. Many myths have grown from old ideas, outdated studies, or misunderstandings passed down over time. Some of these myths can lead to unnecessary fear. Others may keep people from exploring helpful treatments or prevent them from seeing the full picture of what's really happening in their bodies. This book is divided into 5 parts, each tackling a different category of myths. Part 1 explores where scoliosis myths come from, including common misunderstandings about posture, genetics, and risk factors. You'll learn why things like backpacks and high heels don't actually cause curves, and how scoliosis can affect people of all ages, not just teen girls. Part 2 focuses on how scoliosis really progresses. We take a close look at common fears like your curve stops after puberty. In Part 3, we dig into treatment options and the confusion that often surrounds them. Many people are told that wearing a brace will stop their curve for sure, or that surgery is the only fix once the curve gets big enough. We break down the research behind these claims and introduce new ideas like brain-based rehab and customized care plans. You'll see that there are more choices than most people realize. Part 4 is all about movement and lifestyle. Should kids with scoliosis skip sports? Will exercise make the curve worse? Is yoga helpful or harmful? These chapters answer those questions using real-world data and clear explanations that help families make informed decisions without fear or guilt. Finally, in Part 5, we talk about what it means to live well with scoliosis. Many people assume that scoliosis always causes pain or limits what someone can do in life. But that's not true for everyone. We'll highlight stories of people who have accomplished amazing things with scoliosis, from athletes to surgeons to CEOs. And we'll give practical advice on managing symptoms, improving quality of life, and feeling empowered in your care journey. Throughout the book, you'll find real stories from scoliosis warriors, easy to understand science, and tools you can use to advocate for yourself or a loved one. Our goal is to replace confusion with clarity and fear with facts. Whether you're newly diagnosed, a parent looking for answers, or someone who has lived with scoliosis for years, this book will help you separate truth from fiction and move forward with confidence.